March, we're in March now, it's Colorectal Cancer Awareness Month. It's a good time to talk about getting screened for what is an extremely preventable disease. Chris Heinen is a researcher at UConn Health Center who studies colon cancer. You're here to talk about some information, some of your work, but first and foremost, many people at this point may know someone in their family or a friend who has had colorectal cancer, but screening is a huge thing that everybody needs to know about.
Absolutely, that's right. Colon cancer is certainly, it's the second most common cancer to men and women combined, but it is preventable. And certainly family members with cancer give you an increased risk of developing the disease yourself, but certainly most cancers, most colon cancers, arise with no family history, so really everyone needs to be screened. The biggest risk factor actually is age, so anyone 50 or older really should be screened.
Now you do a lot of work with the family connection piece of this, so talk about some of your work in the labs. You're a PhD, but not an MD, so this is a different spin on what we normally talk about it, but it's interesting. What's some of the research going on?
So we do study hereditary colon cancer. This is a disease where patients inherit from their mother or their father, and they're at a greatly increased risk of developing colon cancer, and usually at a much younger age than the average population. However, this inherited disease is quite rare. It accounts for maybe 5% of the cancers in the United States. But we study it in the laboratory because by studying this disease, we can learn an awful lot about colon cancer in general that would affect the average population. So one of the things that we've learned by studying this disease is that the genes that were responsible are part of a pathway that repair damaged DNA. So DNA, of course, is the genetic content that encodes everything for who we are. Right. And our DNA is constantly under assault, really, both from without, things like radiation from sunlight, chemicals we take into our body through our diet, etc. And so this damage to the DNA structure that's occurring can lead to mutations that cause cancer. Now, fortunately for us, we've evolved such that we have a very complex pathway of proteins that can respond to this damage, to repair it if possible. Or in the case where a cell has a lot of damage, these pathways can actually activate what is essentially a suicide process to eliminate the cell. So the idea being that a damaged cell is dangerous, it's better to get rid of it altogether instead of running the risk of that becoming cancer. And so we learned a lot about this by studying these hereditary colon cancer families because it turns out, as I said, the gene responsible is a member of one of these DNA damage response pathways called mismatch repair. And so by studying this disease, we learned an awful lot about how this pathway affects cancer in general.
Now, people at home who either have a family connection or are concerned or just want to kind of throw their hat in the ring and say, how can I help? There is a way at the health center.
Absolutely.
They need some people to be part of the study, right?
Yeah, so in the last couple of years, we've started what's called the Colon Cancer Prevention Program at the UConn Health Center. And this is really an interdisciplinary team of doctors led by Joseph Anderson. We have epidemiologists, human geneticists for help with the family history component, and basic scientists such as myself and Dr. Daniel Rosenberg, who's the head of this program. And of course, the patients are an important part of this team. Right. And really, we work together as a team to try to come up with new and better ways to prevent colon cancer. And really, the most important thing from the patient's perspective, of course, is to get in there and get that screening colonoscopy. Absolutely.
If you are interested in being part of this, the program, we have a number here to show you the Colon Cancer Prevention Program, 1-800-535-6232. Chris, thanks so much for coming in and sharing your knowledge.
Thank you very much.